Morning, Peter.
Hi, Mair.
Hi. The first question that our members have asked is that patients are asking for sick notes because their employers have told them if they can't work because they're self-isolating or they're at high risk of COVID, that they're going to need a sick note. What happens when patients ask for this?
Well, there's, patients go to the NHS website, they can actually download a self-isolating sick note that covers them for up to 14 days. But of course, we're also getting requests from patients who are in the vulnerable category, and they're wanting essentially a sick note for 3 months. Now, many of these have had letters from the Chief Medical Officer, and they're able to use these letters to give to their employers. Or indeed, I've had patients wanting, saying that they need them for Tesco deliveries and such like.
Oh.
But unfortunately, some of the letters that have been going out haven't been going to some of the at-risk patients, and it's acknowledged that the list is incomplete. So many of these patients are coming to GPs and saying, "Look, I haven't had a letter. Am I at a highly vulnerable group?" The answer is, for some of them, yes, and GPs will have to give them a letter. So my practice, we've got a pro forma letter that we just print off for them, and it seems to work. Complicated area, though.
It is, but that sounds a useful resource for the practice, Peter.
I mean, if anybody wants a copy of our letter, and I think this is one of the strengths about being in the college, is that we can all share good ideas. If anybody wants a copy of the letter we're using, if they just email into the college, and we can send out a template.
Thanks, Peter.
I mean, it goes on to say that, you know, we're all actually working very hard at the moment, both in practice and I mean, the last 2 weeks seems to have been in my head a sort of a merry-go-round of teleconferences and video conferences to try and get things sorted out. And I just wanted to remind members that we continue to be backed up by a strong team of our staff in Wales. That you and I have been talking to officers in London at Euston Square, or rather not at Euston Square now, but throughout the country, in developing some of the strategy that we've been able to work on with members and with Welsh Government, and I think it'd be quite useful, really, Mair, if you could maybe highlight some of the things that we've been working on in the last few weeks.
Yes, and PPE has been the biggest thing. We were very unhappy that our members seemed to be exposed and having limited access to PPE in the beginning, and we brought that up with Welsh Government. And pleased to say that there's now some new guidance on PPE, and it does seem as if the supply of PPE to practices and the advice to use PPE for all patients, because we don't know who's carrying COVID and who is transmitting the virus. It does seem as if that has improved. So we're very pleased with the outcome of that, and we hope that some of the messages that we were giving to government were heeded.
And you've particularly been leading on the area of sort of Welshifying some of the guidance for advanced care planning, haven't you?
Yes, this was something that we asked our members if they thought this would be useful. The letters had gone out to very vulnerable patients, and there seemed to be very little guidance that was easily accessible for our members. There's lots of guidance out there, but some of it is really quite detailed. So we were able to use the resource from RCGP Scotland and modify it for our own use, and turn it into what I think is a very easily read document that's not too long and has a performer that's on one page, so that you can think about the things that you want to ask your vulnerable patients.
Yes, and at least the other area we've been pushing for is access from home, because many members will have to be working at home because they're self-isolating, and it's important for them to be able to help out of the practice, maybe with telephone triage and similar. So we seem to have made some progress in getting NWIS to move on the access from our own home computers, and it's something I'm going to trial out later on this morning with my own computer, see if I can dial into our practice computers.
Yeah.
So it's
sorry. You finish.
No, you carry on. I mean, this is really interesting, isn't it? We're trying to learn. I think all of us, members as well as officers throughout Wales and the whole country, have been trying to get used to the etiquette of teleconferences and video conferences and all that.
Yeah.
So you carry on now, please.
Okay, I was going to say that I've had my access for Access Anywhere has arrived. I haven't logged on yet, but hopefully it'll enable me to carry on doing some shifts with out of hours once things settle down in the college a little bit. One of our members did complain about the VPNs and having to pay for them, and it seemed a little bit silly that had happened first, and then this Access Anywhere seems to be free for all members. So I can understand some of our members being a little peeved at having to pay for VPNs.
Yeah. I mean, it's interesting that we're doing things like you're doing out of hours at home. One of the areas that I think that you mentioned that I think we're going to have to try and do some work is there seems to be a bit of confusion across Wales about who is doing what is the role of the out of hours going to be, what is the role of in hours general practice, how are COVID centres going to work with the two, and because we cover the whole of Wales, we can actually see slightly different patterns developing across Wales. So one of our objectives is to work with NHS Wales to try and ensure that the best patterns of work are occurring throughout Wales and sharing good practice, really, because I think some of our members, like me, remain confused.
Yes, things are moving so fast, aren't they? It's really hard to keep a track of what's happening throughout Wales, and I think that that's something that we should be really taking a lead on as RCGP Wales joint chairs, is trying to find out what's happening and sharing best practice. And I think if our members are finding that what's organised in their area isn't working, then I think we have a role to bring their concerns to the attention of the NHS in Wales and try and make sure that everybody is getting the best possible support for the coming weeks ahead.
Yeah. So we've had some other questions coming in, and one of the questions that somebody asked about B12 injections, and I think you probably saw the email that I saw. We've had some approaches in the college from, I can't remember the organisation, but it's for people who have B12 injections because they've got pernicious anemia. I'm not quite sure the title of the organisation, but they were saying, well, what are GPs doing about giving B12 injections? And excuse me, I find B12 injections quite interesting because patients seem to want them at a particular date. I'm feeling the levels are dropping, doctor. Could I come a week early? They sometimes ask, and things like that. When in actual fact, if you look at the blood levels of B12, they're actually sky high in most of these patients, and theoretically, there's no reason why most of them can't go a month or two without having them. But I mean, so I don't know what you've heard, but I've heard a couple of ideas. One is that get patients to self-administer, but then that raises the question of how safe is it to get people who haven't given iron injections to give them.
I guess that's something that's really difficult to teach over a video consultation. I agree with you, Peter. Most patients have adequate levels, and I think the concern was that patients were going to have irreversible neurological consequences if their B12 was withheld. But I guess for most GPs, it's a balance between bringing patients to the surgery where they may be exposed to COVID, and keeping them safe by keeping them at home. And I guess for each patient, the GP is the best person because they will know what their levels are. If they are somebody who's at risk and has extremely low levels, then I guess you have to weigh up the risks and balances. And I think that's what we're very good at as GPs, is weighing up what risks our patients should be taking and what risks we should be taking.
We're the best in the NHS about risk management, I think, because we are willing to take risks in the managed risks, sensible risks, to the benefit of our patients, I think, and the service. So one of our strengths. And I think one of the messages is talk to your colleagues. If you're not sure what to do, and that frequently happens to me, I'll just ask others in the practice, or if you're working on your own, then use our network. I mean, we've got a really good members forum, which is very active at the moment. And I'd encourage any members to sign up to the members forum and swap ideas with others on the on that site. You
need to be careful, Peter, because there are two members forums now. There's one that's active through the COVID hub at RCGP UK, and members are welcome to join on that and share ideas across the UK. But we also have a Facebook members forum that's run by our Deputy Chair, Rob Morgan, and that is a more informal, put what you like on there within reason, and we'll try and get back with an answer to you. So that's on Facebook, and I would encourage you to sign up for both.
Yeah, I think that's a good idea. And we are trying to answer any sort of sensible questions that are posted there. We will take, if we can't answer them ourselves, we'll take them forward for you to NHS Wales or Welsh Government or whoever is most appropriate. So yes, it's important, those.
So, and some of the questions that we've answered today have come through the COVID hub with the email address there. So any questions, if it's obvious that it's our member, if it's obvious that it's a member from Wales, so any questions are sent through the RCGP query hub, then if it's obviously from Wales, then we will endeavour to put a Welsh answer to it.
Yeah. So, I mean, that's also an important way of mutual support. So if you're feeling under pressure, things have happened, you want to raise it in a friendly and supportive community, then our members forum can offer that. But I mean, there's other ways as well, Mair, that we've been thinking of enhancing our support offering.
Yes, you mentioned something on the members forum in Wales, and one of the things that Rob is setting up is a buddy system for people who may be feeling very isolated. If you're a locum and you feel that you haven't got a home or you haven't got colleagues that you can share things with, then Rob is willing to pair you up with somebody else who's feeling a bit isolated, even if it's just somebody that you can share a chat with online or share an email with. We feel that that's helpful. The COVID hub has got a lot of access to wellbeing resources, and in Wales we have Health for Health professionals which will be able to offer you support as well if you need additional support.
Yeah, it's really important to think that to realise you're not alone in all this. And you know, I don't mean to sort of turn a bit bleak, but I think that we will be faced as GPs with some, you know, challenging and probably quite anxiety-inducing and you know, things that we're going to have to deal with in the next few weeks. So please bear this in mind.
Yes, remember it's okay. It's okay not to be okay, and there are going to be some difficult consultations, some difficult decisions, some difficult conversations, and just remember that there is always somebody that you can turn to and you can talk to.